Hi, I'm Garvin. Welcome to our telehealth video series. In this video I will give a brief overview of what you need to know about sleep apnea. In particular, I will cover what is sleep apnea, how you treat sleep apnea and how you can live more comfortably with sleep apnea. So to start with, what is it? Normally, during sleep, air moves through the throat and in and out of the lungs at a regular rhythm. In a person with sleep apnea, air movement is periodically diminished or stopped. There are two types of sleep apnea: obstructive sleep apnea and central sleep apnea. In obstructive apnea, breathing is abnormal because of narrowing or closure of the throat. In central sleep apnea, breathing is abnormal because of a change in the breathing control and rhythm. So approximately 25% of adults are at risk for sleep apnea of some degree. Men are more commonly affected than women. Other risk factors include middle and older age, being overweight or obese, and having a small mouth or throat. So how sleep apnea occurs? The throat is surrounded by muscles that control the airways for speaking, swallowing and breathing. During sleep, these muscles are less active and this causes the throat to narrow. In most people, this narrowing does not affect breathing. In others, it can cause snoring, sometimes with reduced or completely blocked airflow. Insufficient breathing due to apnea or hypopnea causes oxygen levels to fall and carbon dioxide to rise. Because the airway is blocked, breathing faster or harder does not help to improve oxygen levels until the airway is reopened. Typically, the obstruction requires the person to awaken to activate the upper airway muscles. Once the airway is opened, the person then takes several deep breaths to catch up on breathing. Awakening from sleep causes sleep to be unrefreshing and causes fatigue and daytime sleepiness. Anatomic causes of obstructive sleep apnea. So most patients have OSA, or obstructive sleep apnea, because of a small upper airway. Obesity is another major factor. Tonsil enlargement can be an important cause as well, especially in children. So sleep apnea symptoms. The main symptoms of OSA are loud snoring, fatigue and daytime sleepiness. However, some people have no symptoms. For example, if the person does not have a partner, he or she will not be aware they are snoring. Fatigue and sleepiness have many causes and are often attributed to overwork and increasing age. As a result, a person may be slow to recognize that they have a problem. A partner often prompts the patient to seek further medical care. Other symptoms may include restless sleep, awakening with choking, gasping or smothering, and morning headaches, dry mouth or sore throat. Waking frequently to urinate and awakening unrested and groggy. Low energy, difficulty concentrating and memory impairment. Risk factors. So certain factors increase the risk of sleep apnea. Increased age. So OSA occurs at all ages, but it is more common in middle and older age adults. And being male, OSA is 2 times more common in men, especially in middle-aged men. And obesity, the more obese a person is, the more likely he or she is to have OSA. Sedation from medication or alcohol, so with potentially dangerous consequences. And abnormality of the airway. So sleep apnea consequences would be complications of sleep apnea can include daytime sleepiness and difficulty concentrating. The consequence of this is an increased risk of accidents and errors in daily activities. Studies have shown that people with severe OSA are more than twice as likely to be involved in a motor vehicle accident as people without the condition. In addition, people with untreated OSA may have an increased risk of cardiovascular problems such as high blood pressure, heart attack, abnormal heart rhythms or stroke. The risk may be due to changes in the heart rate and blood pressure that occur during sleep. So how do you treat it? The goal of treatment is to maintain an open airway during sleep. Effective treatment will eliminate the symptoms of sleep disturbance. Long-term health consequences are also reduced, and most treatments require nightly use. Continuous positive airway pressure, or CPAP, the most effective treatment for sleep apnea, uses air pressure from a mechanical device to keep the upper airway open during sleep. The CPAP device uses an airtight attachment to the nose, typically a mask, connected to a tube and a blower which generates pressure. Adjust sleep position. So next is adjust your sleep position to stay off your back. This may help improve sleep quality in people who have OSA when sleeping on the back. However, this is difficult to maintain throughout the night and is rarely an adequate solution. Weight loss is next. Weight loss may be helpful for obese or overweight patients. Weight loss may be accomplished with dietary changes, exercise, or surgical treatment, and avoid alcohol and other sedatives. Alcohol can worsen sleepiness, potentially increase the risk of accidents or injury. And dental devices. A dental device called an oral appliance or mandibular advancement device can reposition the jaw, bringing the tongue and soft palate forward as well. This may relieve obstruction in some people. This treatment is excellent for reducing snoring, although the effect on OSA is more limited. And surgical treatment. So surgery is an alternative therapy for patients who cannot tolerate or do not improve with non-surgical treatments such as CPAP or oral devices. Surgery can also be used in combination with non-surgical treatments. And how do you live with sleep apnea? In many cases, self-care may be the most appropriate way that you deal with the obstructive sleep apnea. So you could try these tips at home. Lose weight. If you're overweight or obese, even a slight loss of weight may help relieve constriction of your airway. Losing weight can also improve your health and quality of life and may reduce your sleepiness during the day. Exercise. Exercising such as aerobic exercise and strength training can help improve your condition. Aim to exercise 150 minutes a week and generally try to exercise most days of the week. Avoid alcohol and medications such as tranquilizers and sleeping pills. Alcohol can worsen obstructive sleep apnea and sleepiness and may lead to weight gain. Certain medications also can worsen your sleep. And sleep on your side or abdomen rather than on your back. Sleeping on your back can cause your tongue and soft palate to rest against the back of your throat and block your airway. To prevent sleep or sleeping on your back, try sewing a tennis ball into the back of your pajamas top. And keep your nasal passages open while you sleep. If you have congestion, use a saline nasal spray to help keep your nasal passages open. Talk to your doctor about using nasal decongestants or antihistamines, because some medicines may only be recommended for short-term use. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist in managing sleep apnea more effectively on a day-to-day basis. We have various services and products which you can purchase from us without a prescription, such as the Quit Smoking Program and a Weight Loss Program service. We also stock light boxes to promote relaxation and blood pressure monitors and blood sugar monitors to monitor your health. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30 minutes clinic with us and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing your illness with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.